Greetings, my friends. This is Dr. Jaime Daniel, and welcome to my show. Today, I want to share with you an overview of Paquioniquia congenita. Paquioniquia congenita is a rare genetic disorder that affects the skin and nails. The symptoms usually begin at birth or early in life, and the condition affects people of both sexes and all racial and ethnic groups. Paquionychia is caused by mutations affecting keratins. They are proteins that provide structural support to cells, and it is classified into 5 types based on which keratin gene harbors the mutation. Symptoms vary from person to person and depend on the type, but thickened nails and calluses on the soles of the feet occur in almost all cases. The most debilitating symptom is painful calluses on the soles that make walking difficult. Some patients rely on a cane, crutches, or a wheelchair to help manage the pain of walking. There is no specific treatment for Paquionychia, but there are ways to manage the symptom, including the pain. People who have Paquionychia congenita have a mutation in one of 5 keratin genes. Researchers have found more than 115 mutations in these genes that are linked to the disorder. In some cases, Paquionychia is inherited from a parent, while in others there is no family history and the cause is a spontaneous mutation. The disorder is genetically dominant, which means that a single mutated gene copy is enough to cause the condition. Paquionychia is very rare. It affects people of both sexes and all racial and ethnic groups. There are 5 types of Paquionychia congenita, and they are classified based on the keratin gene that is altered. Thickened nails and painful callus on the soles of the feet are typical of all forms of the disorder, but the presence of other features can depend on which keratin gene is affected and possibly on the specific mutation. The symptoms and severity of Paquionychia congenita can vary widely, even among people with the same type or in the same family. Most symptoms typically appear within the first month of or years of life. The most common features of Paquionychia congenita include things like painful callus and blisters on the soles of the feet. In some cases, the callus itch. Calluses and blisters may also form the palm of the hands. Thickened nails. Not all nails are affected in every patient with Paquionychia congenita. In some people do not have any thickened nails, but the vast majority of patients have some affected nails. Cysts of various types. Bumps around hair and friction sites, such as the waist, hips, knees, and elbows. They are most common in children and lessen after a teenage year. White films on the tongue and inside the cheeks. There are also less common features of Paquionychia congenita, and they include things like sores at the corners of the mouth, teeth at or before birth, white films on the throat resulting in a hoarse voice, intense pain on first bite. First bite syndrome is also another name that it receives. The pain is near the jaw or ears and lasts 15 to 25 seconds when beginning to eat or swallow. This is more common in younger children and may cause feeding difficulties for some infants. It typically goes away during the teenage years. Paquioniquia congenita is caused by mutations in genes that encode keratins. They are proteins that are the main structural components of skin, nails, and hair. The mutations prevent keratins from forming the strong network of filaments that normally give skin cells strength and resilience. As a result, even normal activities like walking can cause cells to break down, ultimately leading to the painful blisters and calluses that are the most debilitating features of the disorder. There is no cure and there are no specific therapy for Paquionitis congenita. The main goal of treatment is relieve the pain by most people with the condition. Your doctor may recommend the following treatments for calluses. Thinning the calluses. Regular grooming of the feet is a mainstay of treatment. It is important not to trim too aggressively, as overly thinning the calluses can increase the pain. Conversely, trimming regularly as needed is important because overly thick calluses can also increase the pain. Physical abrasion, such as paring or filling the calluses area, is the most common approach. Soaking the skin prior to abrading is helpful for some people, while many others pare or file their calluses themselves. Others see a podiatrist, a medical professional who specializes in caring for the feet. Oral retinoids, which are related to vitamin A, can thin calluses, but they may not decrease the pain and in some cases they increase it. If a doctor prescribes this, he or she will carefully monitor the dosage and during of treatment. Moisturizing creams or lotions can provide relief by softening the skin and preventing cracks. Over-the-counter or prescribed anti-inflammatory and pain medication may help temporarily alleviate pain and are sometimes taken prior to engaging in physical activity to get ahead of the anticipated pain. Special orthotic insoles. This can redistribute the weight on your feet and provide relief from pain in severe cases. A person may need a cane, crutches, or a wheelchair. Nails and kystes. Your doctor may recommend the following treatments for thickening nails and kystes. Thickened nails, like regular trimming. Nails are not usually painful, but they can become so if they become infected or broken. Bleach bath. Routinely bathing your nails and feet in mild bleach solutions can help prevent infections. You should not use this treatment without first talking to your doctor. Oral antibiotic or antifungal medications. These may be needed if infections develop. surgery to remove especially troublesome nails. Kystes. These may need to be drained or surgically removed. Your doctor may prescribe antibiotics if kystes become infected. Antiseptic cleansers may help prevent flare-ups. Having a painful disorder like Paquioniquia can be challenging, but the following may make it easier to manage. For example, maintain a healthy weight and limit walking and standing. This may lessen the pain from the callus on the soles of the feet. Wear comfortable shoes and socks that reduce moisture. This may help decrease rubbing that can worsen painful calluses. Wear gloves to protect the hands during activities like riding a bicycle or using hand tools. If you have white patches in the mouth, brush your teeth and tongue frequently and gently to reduce their appearance. Infants with this symptom may fit better if you use a bottle with a soft nipple and wide opening. Use moisturizers such as those that contain petroleum jelly or lanolin to soothe the bumps that develop near friction sites such as the waist, elbows, and knees. Visit a mental health care provider or join a group to support. This can provide emotional support and help you cope with the feelings of isolation that often come with having a rare disorder. Remember to visit your health care provider regularly and to follow their recommendation. Well, I hope you enjoyed this episode and we will see you in the next one. Thank you.